Thank you, Mr. Chairman. And thanks all of you for your testimony here today. I know from my experience as Attorney General what a catastrophic impact this epidemic has on the people that live in my state, I'm sure throughout the country. What I don't appreciate as much is the impact it has on seniors in the different ways I think they're particularly vulnerable to people who are trying to game the system, as Dr. Coburn has talked about. And what I'd like to find, and I open this question to any of you who feel competent to answer it, is what are the particular focuses on this, on a population that is clearly vulnerable to this? They trust their doctors, they want to get better. Some of them have long-term illnesses that they're dealing with, and in some cases it's just easier to try to medicate your way out of those illnesses than it is to try to talk with a family and get to the heart of what's going on. Are there relationships between, for example, assisted care facilities or nursing homes that are particularly problematic in this area that lead to this kind of abuse?
I don't know that I can directly answer the question, but with regard to the vulnerable population of the elderly being in nursing homes and some of these drugs being very powerful, we did do a random review of antipsychotic drugs as used in the nursing home setting, and we found that 88% of them were prescribed against the black box warning, clearly raising health concerns. And based on the medical record review, we found 51% of the claims shouldn't have been paid by Medicare. Mm-hmm. So when we did that kind of in-depth review in that vulnerable setting, we did in fact find substantial problems.
Okay. Ms. Lovell, we talked about doctor shopping. Mm-hmm. As a part of this problem. And I know, again, in my own experience, seeing some of the typical populations that engage in this behavior, is that a problem? Do we see that among the senior population as well?
Frankly, when I speak of the doctor shoppers, the majority of what we're seeing are those that are under 65. They're dual eligibles, usually Social Security, disability. Mm-hmm. We just referred 8 cases last week, and all of them were under 65.
Okay. And do you have any statistics or information that's available to tell us what percentage, or in your experience, you see that are over 65 that are engaging in this behavior?
I don't have any exact, but I can get that for you.
Okay. Pain clinics and pill mills. Mr. Ranazizi, I know that your experience with the DEA, again, talking about the senior population, are they being exposed to a greater extent in those settings than we find other patients are?
I don't believe so. The pain clinic cases that I've reviewed have generally a younger population of drug seekers that are going there. Remember, they're not going there, these rogue pain clinics, they're not going to get medical treatment. They're going to get medication to feed their addictions. So it's not really medical care. It's more of drug distribution, illegal.
Okay. And Mr. Blum, I'd like to ask you about the enrollment process. What factors do you think provide the greatest deterrence to keeping out the kinds of physicians that we don't want involved in these programs?
I think what we've learned from our fraud prevention system is that we've got to do 2 things at the same time. We have to validate physicians' credentials, and that has to be periodic. And one of the most important changes that the Congress made to direct CMS to require this process. That's not true in the Part D program. There are many prescribers who are legitimate but aren't formally part of the Medicare system. For example, dentists are one of the most commonly frequent prescribers of pain medications. So I believe that every physician who is writing scripts for the Part D program needs to be enrolled in the Medicare system so we can validate. We're not reliant on self-reported databases. We can verify those who are truly massage therapists versus those who are just self-reporting as massage therapists. That's a change that I believe that the program needs to make. It's going to place new burdens on physicians, and I'm sure this Congress will hear pushback from the physician community that is burdensome, that for those prescribers that don't provide medical services, they shouldn't be enrolled. But I do believe that it's time that we move to a different framework.
Okay. Mr. Ranazizi, we worked in New Jersey with the DEA to establish drop box programs where people can take their unused prescription medications to those locations and get rid of them, no questions asked, in a secure location so that other family members can't abuse them. In your experience, how effective do you think those programs have been in getting at the potential problem of the legitimately prescribed prescription drugs to a grandparent being then used inappropriately by one of the younger members of their household?
Well, we've taken the position that those medications, once they're expired or unneeded, need to get out of that household. That's why we have these nationwide take-back programs. In April, we took in almost 376 tons of pharmaceuticals in the last take-back program. I think that we are in the process of drafting the final regulations for take-back, so we may have these drop boxes available across the country in certain authorized locations, and I think that will go a long way to preventing such tragedies as what we've seen in the past.
And nationwide, what percentage of the states participate in these programs, the drop box programs?
Well, currently, the only drop box programs that are allowed are ones in law enforcement facilities, either precinct houses or headquarters places. But I can't tell you exactly how many because law enforcement agencies are exempt from the statute, so they could put their drop boxes in the facilities without reporting to DEA.
Okay. But anecdotally, I know, for example, we've talked about it actively in New Jersey. Do you get the sense that many states are getting involved in these programs or not?
Yes, I believe quite a few states are getting involved in the program.
Okay.
And some states have their own program. I believe North Dakota has their own program now. So.
Okay. Well, thank you. Thank you, Mr. Chairman.